And I can't hide. These growing pains are keeping me up at night.
The information that we share today is from our own personal experiences and does not constitute medical advice. We do not endorse any products or services. Any said products or services mentioned on this podcast may not be suitable for you or your condition. Please consult with your physician if you have medical questions as it may pertain to your condition.
Hey everyone, welcome back to this week's episode on Take a Pain Check. On today's episode, I'm so excited to be speaking with Jenny. Jenny is a patient advocate on social media. So hi Jenny, thank you so much for coming onto the podcast today. Can you start off by introducing yourself and your diagnosis?
Sure. Hi, my name is Jenny Weaver. Most people know me as Gracefully Jen on Instagram. I have a couple different diagnoses. One of them is anxiety, had that since I was 12 years old. But the one that I'm most known for is rheumatoid arthritis, and I was diagnosed around 2011, and in 2017, medically induced pustular psoriasis.
Wow, so that's a handful of diagnosis. So like around what age were you at when you were diagnosed with rheumatoid arthritis?
I was diagnosed when I was 31.
Okay, so that's kind of not in high school, non-university, but kind of job time sort of area of.
Yeah.
What symptoms did you experience that kind of led you to seek medical attention?
So it actually began with my knee, and the first time I think I went in probably around 2010 talking to them about my knee. They did some scans, they didn't find anything. They just told me just take it easy, maybe I was working out too hard, and it went away. But then it came back again. And this time it was to the point where it was waking me up at night and it was causing me to cry because I was in so much pain that I couldn't sleep. And so finally I went in to see my doctor again. And that is when he thought I had an infection in my knee. He thought it was a strep infection in the bone of my knee.
What? Oh, so that wasn't rheumatoid arthritis then?
It was. He didn't know. So he actually put me on 90 days of antibiotics and it didn't get better and it just kept getting worse. And then my hands started to hurt and then my shoulders started to hurt. And that's when he was like, let's do some blood work and figure out what's going on. And after the blood work, he was like, okay, it's time to see a rheumatologist.
Was that a long kind of time frame, or did that occur like within a year, a few months?
Within a year, but it was really, really long process. And then of course, when they were trying to get me in to see the rheumatologist, it was right around Thanksgiving. And so having holidays coming into play, that made it that much more difficult. And on top of that, the staff at my doctor's office kept dropping the ball and they weren't sending all of the stuff the rheumatologist wanted to get. And so they were playing this game back and forth, and it took them months to get me in, all because of that. And so it was probably January, February by the time I got scheduled.
Wow. So kind of a long time, but kind of a few months timeline in a way.
Yeah.
I guess I see how the miscommunication can definitely like make things longer. And I think all the time, like in doctor's offices and two different specialists, that is so common for it to happen. Like I get a blood test from my rheumatologist, I get the results, but then I also want my family doctor to have it. And then that takes like so long to get it there. And it's a lot. So I feel you.
Yeah. And I mean, it wouldn't have been so bad, except I'd already been going through that whole progression of trying to deal with the regular doctor and the 90 days of antibiotics. So, I mean, it ended up being like 6 months in total before I saw the rheumatologist.
And so did you kind of advocate, to your first physician? Was that your family doctor? Like who was it?
It was my family doctor. Yeah.
So did you advocate, for yourself to your family doctor saying like, okay, this is not strep or anything like that. Like this has to be something else?
Or... So that's when my husband stepped in.
Okay.
My husband was getting really frustrated. He's like, she's not making this up. We need to figure out what's going on. Everything that you think is happening with her is not true. We need to help her better.
You had that support. And did you find that it was hard for you to advocate? Like it was really helpful having someone else at those appointments?
It was really hard because I had been sick for so long, and then also being on all those antibiotics, it screwed up my stomach. I lost like 30 pounds, and I'm short. I'm only 5'2", so I literally looked like a 12-year-old. I looked like one of my kids because I'd lost so much weight, and I just looked so sickly. And I was like a basket case of emotions and pain. And so it was like I just shut down.
So how did you kind of help yourself emotionally to, you know, stay strong? Because like you mentioned, there was just so many things going on. Like it was, you were at such a like low point in your life.
My kids were in middle school, and when I got them to school, I would go home and take a nap and feel sorry for myself. And so it was kind of like I just let my world shut down. Thankfully, I had friends and family that stepped in and tried to be there for me and tried to help me through it.
So
Yeah.
you saw one rheumatologist, or did you see multiple rheumatologists?
I ended up seeing two. So the first one, he did not diagnose me, but he kept prescribing disease modifiers because he knew there was something rheumatic going on, but he wasn't sure what. And I think that those months of antibiotics had screwed my stomach up so much, and he saw how much weight I lost. So he started to think I had something going on with my stomach just because of all of that. And so he wanted me on prednisone, and he wasn't even talking about the pain part. He was like, well, I need to get you on some prednisone. We need to get some weight back on you. And I was like, okay.
Like for the wrong reasons.
Whatever. And that's when he started me on those typical disease modifiers that a lot of people start out with. The first two, I had allergic reactions right off the bat.
And how was that?
I had allergic reaction to sulfasalazine and Plaquenil.
I'm on both of those right now, but it's interesting to, I'd love to hear, you know, what was that allergic reaction all about, and how long did you take those medications for that to happen? Like, was it off the bat?
Okay, so I feel like I'm gonna mix them up. So I don't even want to say which one did which, because I've had so many allergic reactions.
Okay.
So one of them, I went to visit my parents who live out in the middle of nowhere, and it was during spring break, and the little town they live in, their doctor's office shuts down and there's no hospital nearby. I got up in the morning, I went down to join the family for breakfast. I was washing my hands, turned around from the sink, and I went to tell my husband that something didn't feel right. And before the words could finish getting out of my mouth, everything went black and I hit the ground.
Wow.
And I had a seizure.
Wow. So how did you know it was the medications and not something else?
So as soon as I woke from what was going on, they rushed me and got me on a couch. I'd cut my lip open, hit my head, I'd bruised it. They had ice on me, the whole thing. My husband whipped out his laptop and started researching, because I'd only been on the medication maybe a week or two, not very long. And so he started researching it, because anything else I'd taken, I'd been on a while. So he was like, whatever's going on, you've never had this happen before, it's got to be this. And when he started reading about it, that was a possible allergic reaction.
This happened at your parents' place, and then now it's like you went to the hospital. So did you go back to your rheumatoligist, or did you email your rheumatologist about the situation?
Okay.
How did that work to kind of something else?
So I had no hospital no nearby, no doctor. So we had to call my rheumatologist. Luckily, it was a weekday. And so we called the rheumatologist, and they were like, well, you're on a seizure medication. You have seizures. Why are you blaming it on this? And we're like, what are you talking about? I'm not on a seizure medication. I've never had a seizure in my life. And we had to argue with him and be like, look at my file. He just looked through the file, saw the medication, and assumed, oh, you're not having an allergic reaction. Call your regular doctor. Your seizures are just acting up. And we had to say, no. I've never had a seizure in my life. We've done the research. This medication you just put me on, it's linked to having this problem.
Yeah. And did the doctor believe you at the end? Like, is that why you kind of switched doctors?
So he finally did believe me, and that's when he switched. And when he switched, I had another allergic reaction. I was covered in hives. And we finally said, well, why are you putting me on medications without a diagnosis? Oh, well, because most autoimmune diseases we use with the same medication. So while we try to figure out what's wrong with you, we want to at least start helping you. Well, I don't like you. We're done.
Yeah, I can't believe that, because you just feel like it's all trial and error, and like on top of not having a diagnosis, it's like you're just giving me medications, but you don't even know what's wrong with me. Like, what if I don't have an autoimmune disease? Like, what if I have something else? You're just gonna give me the generic medication everyone else gets without any kind of proof.
Yeah. And my husband finally was like, wait a minute. So you want to potentially give her more problems instead of figuring out this problem. So you want to give her medications that are going to create more crazy? Like, that doesn't make sense.
Yeah, especially because he knows that you have allergic reactions from these medications, and he's still kind of giving you those.
Yeah. So after that, I was like, okay, we're done here. I found out about another doctor. I'm going to try this one out.
And how did that go for you? Are you still with the same doctor?
Still with the same office. The actual doctor had retired, so I still see his PA, and they have been wonderful.
Okay, that's really good. So, you've been on a lot of medications, you've had allergic reactions. I guess, what are you on right now? Like, how has your medication journey changed from then to now?
So it actually got more complicated. I had even more severe reactions. So with the second rheumatologist, everything was going great. We tried Orencia. Orencia really just didn't do much for me. And so we moved on. And I think the next one was Actemra. And that's when I pretty much hit remission, and I was doing wonderful. I was able to work out again, hike with my family, do all the things that I used to do. They didn't like where my white blood count was. And I guess that medication is known to cause white blood count issues. And so after several months of not liking my blood work, they took me off of the medication that helped me. And so we had to try Remicade. And that is when I had my next really bad reaction. So in some rare occurrences with the anti-TNF inhibitors, there are some people that have medically induced pustular psoriasis.
And can you explain what that is and how that particularly affects you and how you kind of found out?
So one day I woke up and I had little round sores on my leg, and they looked like, I don't know, like an ingrown hair or a bite from a bug. Didn't think anything of it, but they got bigger. And then they started to change, and layers would come off like an onion, and they were oozing. And I started getting more. So I went to see an urgent care doctor because we thought maybe I had somehow got a skin infection or something crazy. And that's what they thought too. They thought I had, I guess in some cases when you go to swimming pools, which we went to the one at our gym, you can get an infection from not super clean water. So he thought I had a skin infection, gave me some ointment, sent me on my merry way. It wasn't working. I went in to see my rheumatologist for my next infusion, and she said, so has anything been going on? Have you had any changes? And that's when I showed her what was going on. And by the time I saw her and showed her what was going on, I had sores all the way from my head to my toe. And they were bleeding and oozing and peeling. She took one look at them and she said, I know exactly what this is, and I'll be right back. When she returned, she brought 2 more rheumatologists into the office to look at me. And they were all whispering and nodding, and then explained to me that I had a rare allergic reaction causing me to have pustular psoriasis. And so they took me off of the Remicade.
Okay, wow. A lot of allergic reactions. So do you think there's any like categories of like, what you're allergic to right now? Because you've had so many allergic reactions to medications. What has, I guess, your family doctor, any doctor kind of said about what medications you can have and can't have? Is there any of those chemical ingredients that have caused something? Do you have any answers about that?
No. And honestly, before all this, I had a seemingly healthy life. Just like anybody else, I'd been on antibiotics for, strep infections, sinus infections, I got colds and flus just like anybody else, took medications for things like anybody else, and never had any reactions whatsoever. It wasn't until I started taking these very strong medications that my life changed.
You see all these reactions happening to you, like, aren't you just scared? Because like if you take another one, like something worse could happen.
Yeah, it terrifies me. And so when she took me off the Remicade, she's like, okay, well, we can try you on Simponi. And she said, well, I don't think it's a classification problem. I think it's just this particular medication. So let's try Simponi. And they're in the same class, but I think we should try it. And I was really hesitant. I was like, I've been through so much. I don't know about this. And we did a lot of research, and finally we were like, well, what are my other options? Like, I'm running out. And so we went ahead and tried the Simponi. I only had it 2 times, and my skin, it happened again. And so that's when she said, I'm really sorry. It's a classification medication problem. And she said, furthermore, you now have had what's called medically induced psoriasis. We're adding this to your diagnosis. You're going to probably have this for life.
Oh my gosh. It sucks that you have to be on so many medications, just to find out what your arthritis diagnosis was. And on top of that, you were like accumulating a bunch of other things to get another diagnosis.
It was a lot. And I was scared. And she sent me to a dermatologist. They had tried all kinds of sprays and creams, and nothing was helping my skin. And it hurt so bad. The palms of my hands, the bottoms of my feet, they were bleeding. And it was horrific. And this happened in 2017. The next time I saw the rheumatologist, I said, everything they're trying at the dermatologist, it's not working. What she explained to me is, because of the allergic reaction I'm having to that classification, that ruled out a whole bunch of medications for me. And she said every medication that we would typically give to someone with psoriasis, we can't give you because it's what is causing it for you. So we have to go a different direction. And so we tried, I wish I could remember the name of it, but it was one of those ones that you inject in your leg where you do the 2 clicks. Okay. And I had to do that every week. And let's see, I think she had me do that for 2 months. My skin started looking a tiny bit better, but it was still bleeding and still hurting. And I looked so raw. And they even described my skin as looking like a burn patient that's burning from the inside out.
Wow.
Yeah.
So, okay. So, this classification was narrowed out, and I feel like that kind of makes you feel better, right? Now, that this whole like class of drugs, like just don't try it or don't.
It's gone. Yeah, it's gone. So hopefully we have no more things we have to be afraid of. That's kind of where I try to go with it. Cause I was like, okay, I can't be allergic to everything.
How long have you not had an allergic reaction for since that time?
That was my last one.
Okay. How is your treatment going now?
Yeah. So actually, after that injector pen didn't work, we found a medication called Otezla. It's a pill. And I was supposed to take that twice a day. And I am mostly under control.
Wow.
So
how long? Like 2011 to like 2017, 2018.
Yeah. But from partway through 2017 up until now, I've been okay. I'm not in remission, but I could be a lot worse.
Yeah. So I guess at that point, you're kind of grateful for what your situation is, because honestly, I don't know. Like, I haven't had any like allergic reactions to medications. I'm on like sulfasalazine, Plaquenil, methotrexate, and it's really rare that I've like talked to someone that had so many allergic reactions, and like you were trying to treat them for psoriasis, but you're kind of experiencing those symptoms. So it's really unique.
Yeah. Well, and now we have to look at me as a whole as having both rheumatoid arthritis and medically induced psoriasis. and having to treat them both together, but not having the options that really I need.
Yeah, it's complicated, but you found a medication that works for you now. And even though it took so long, finally you're here, you made it, you found something, which is so good. So on top of your diagnosis, you're also a mother and a grandmother. How did you manage your arthritis alongside taking care of your 3 children?
It was so not easy. At the time, my husband was working. He'd leave the house about 4:30 in the morning and not get home until 3 p.m. And so I would have to help get the kids out to school and hope that I could handle it. I didn't have any family in town. And so we just did the best that we could. And I had a lot of great friends that were there for me, a lot of support, people that would offer to help me out or go with me to doctor's appointments if I needed company. My kids, I don't think they really understood at the time what was going on, but they do now. They're young adults now. They are 21, 22, and 23.
Oh, wow.
And so they fight for me too. And they're very good supporters of me and protecting when they know I don't feel well. But it was really hard.
Yeah.
I honestly don't know how I did it, but I did. The evenings, my husband would come home and he would make dinner every night. He loves to cook, but he also wanted to make sure that I had the help.
Yeah.
And so I had to come up with chore lists for the kids to really help me out. They would help do laundry, mow the lawn. And it wasn't always like that. I mean, of course, I had my time of remission where I was doing all kinds of things, but they could tell when I wasn't doing well and when I needed all that extra help. They were great.
And so you didn't tell them when they were younger, but you told them later on, like what was kind of the timeline of when you told your kids?
Well, so they knew I had rheumatoid arthritis. They just didn't really understand it or understand how severe. The only thing that they knew is when they got older. So in 2017, they were all in high school. So they saw what happened to my skin, and I think it downright freaked them out because it's not pretty.
Yeah.
And to this day, one of my daughters, she still worries, and she'll call and check on me all the time.
Yeah, I think it's honestly really good to have like family support no matter what, even though they don't fully understand, because obviously they don't live with it. It's nice to kind of have that support, and I'm glad your children check up on you. And your mom's going through all this stuff, and as in like a kid's perspective, it's kind of like I need to help her as much as I can. So you did kind of say like, okay, chores list, laundry, like things like that to help you manage everyday life activities. And what was their reaction to it? Like, was that something they just kind of listened to and picked it up and started doing?
I think they did, but I also tried to make it fun.
How did you make that fun?
So I would get creative. I'd make like dry erase boards and write a list of what needed to be done. And I would actually ask them, okay, each of you pick one. What do you want to do? And to them, that seemed like more fun and a better option because they could pick something they didn't mind doing. But it was really weird. Like I had one kid that would pick cleaning toilets over anything else. And I was like, what is wrong with you?
Yeah.
My son always wanted to help fold laundry. I didn't expect that one. One of my daughters hates folding laundry. She acts like it's the worst thing on the planet. So she's more up for cleaning a toilet or loading the dishwasher.
So it's like their true colors are really coming out when what they actually don't mind doing.
Yeah, I think I see what kind of adult you might be when you move out on your own.
Yeah. How did you know when to kind of step back from parenting and put yourself first? Because obviously, I guess it would be really hard as a parent to kind of be like, okay, like I actually can't do these things that moms do. When was that time, and how did you like kind of come to that realization?
Honestly, I think it was kind of my kids telling me. Like I said, I have one daughter in particular that she would really, I don't know if she's just perceptive more than other people, but she would just be able to tell that I'm not doing good. And Mom, you need to take better care of yourself. And and we're fine. You know, we're in high school, we're doing fine. We don't need you to do these things. And I don't know, she would encourage me to get a massage or go get a pedicure. And she's still like that. All three kids, they're amazing.
That is really nice to hear. So let's kind of get into initiatives and interests because, you know, yes, you've had such a long kind of diagnosis process, medication journey, but there is so much more to that. I think after all that happened, it clearly made you inspired to do something and kind of advocate for yourself. So can you give me a little bit of a background and give everyone else a background about what do you do? How did you get to the point where you're like, okay, I need to start advocating for others and you decided to open your Instagram accounts? Like what kind of made you decide, okay, it's time to open Instagram accounts, advocate for others?
I think it was about a year ago. I just started somehow coming across funny reels that people were making, other people that were like me. And I was like, you know what, this is fun. And I started kind of getting in there and talking to people and making some. And I don't know, maybe 2 months into it, I was like, you know what am I doing? Like, I want to be there for people the way that I needed and didn't have. And so that's when I switched the whole account and made it purely focused on supporting other people with autoimmune diseases, anxiety, depression, all the things. I want to help anyone that is struggling. And if there's a way I can support or find them someone that can support them, I want to do it.
So how do your kids feel about you making reels or like being very active on social media? I know, like, you know, if my mom, for example, was like very active on social media or like making reels, I'd be like, what are you doing? I have 2 siblings and we always have an opinion. So like, yeah. Like I think initially it's kind of like, why is my mom on social media? But
it's funny because I would think that they would be doing these kind of things.
Yeah.
And they're not. That you barely even see them on Instagram or anything. They might be on TikTok scrolling all the time, but they don't create. They're not interested. They definitely, they don't think I'm crazy, but they're not my strong supporters either. You know, occasionally they'll like a reel or think it's funny or send me an audio they think would be fun to use. But they know that's just kind of my personality. I like to have fun. I like others to have fun, and I like learning new things. So they're used to the little bit of crazy that I am.
But yeah, they're used to it now. It's kind of like that's what mom likes. So that's what we got to support.
Yeah, I mean, they're used to me. My husband, he makes fun of it. He thinks it's all nuts. He always is like, oh, she talked drama in high school. She thinks she's funny.
Wow. So it's kind of entertaining in a way too. But I think you kind of find humor and in what you do, and that kind of makes your life better.
If we can't laugh at ourselves,
yeah,
what are we doing?
Exactly. So maybe tell everyone what your accounts are, what your socials are, what type of content you post, how can they find you?
Yeah, they can definitely find me at gracefully_Jen. And that is geared mostly towards rheumatoid arthritis, psoriasis, and anxiety. That's primarily what I talk about. I have on there a chat group of Spoonie sisters, and we do a lot of fun reels together. We pass the spoon and just have a lot of fun and support each other. And that's kind of what spiraled to the other account. And so the other account is called My Spoonie Sisters. And it's kind of blossomed into so much more. There's now a podcast that just released. And so we spend time drinking coffee and talking about what life is like as a Spoonie sister and what we struggle with.
Oh, yeah. So everyone definitely check those out. Like I'll link them in the description so people can check them out. But I think it's definitely nice to see, you know, other people out there creating content about their life experiences, because that definitely helps others living with those lived experiences. Did you have any like hesitations to like not put yourself on social media, not kind of publicize your diagnoses?
A little bit. I don't want to embarrass my family, and I'm kind of a really shy person. So people wouldn't know that. Behind the screen, I can be as silly and goofy as I want, but in person, I'm really shy. And I don't know. I worried about judgment. I worried about people thinking I wanted attention when that's not it at all. I could care less about the attention. I just want to help other people. I want to share with them in case I have something that can help them. Well, I actually, through all this, have met 2 more people with the rare pustular psoriasis.
It's so nice to have that support and find people with the same condition as you, because that way you can relate those experiences and talk, if you have a problem, like not everyone knows what your specific diagnosis goes through, and find people, I have juvenile idiopathic arthritis. If another person has that, then they would relate more to me than they would with someone that has actually rheumatoid arthritis. Like that might be a little bit different. But I think at the end, we are kind of all doing the same thing. We're all advocating for each other, sharing that content to keep people entertained, but also educate them about what's going on in the chronic illness community, connecting them with others. And I see that you've made a lot of kind of friends and acquaintances as well on social media, and that's really good.
It's so important because I think there's so many new people constantly being diagnosed. And so for them to find you or to find me or find someone else that they can relate with or talk to or ask for advice. I have people popping into my DMs all the time. Oh, so-and-so recommended you to me because you're suffering from something I do. I'm honored. I'm honored because they could be finding somebody else or they could be suffering in silence. And so, gosh, I mean, where was this 10 years ago? These podcasts and blogs and everything that's out there, we don't have enough of it. So the more people that create, I think it's the better for everyone because it's more options, right?
Yeah, exactly. So I kind of wanted to end off with an advice segment. And I do have a few questions for you. So what advice would you give to those who are trying to manage their rheumatic condition but they're really stressed out about the whole situation of even having a rheumatic disease?
My advice would be find a support system, find a support group, find people you can talk to, because really talking it through with other people, it's been a profound experience for me personally. And it's so helpful to talk to somebody that understands because they might know something that you don't know to try. You just never know.
Yeah, I totally agree with that. Finding that support is helpful no matter what stage you are at in life. I think you always need support and there's a big community there for you. I think also it's really hard to sometimes find that community. I know when I started Googling, like it's not really on Google, but once you kind of get your like foot in the door, then there's so many options like you mentioned.
Well, and I think even being able to research the hashtags on Instagram, that's so helpful because you're just flooded with content after that and you can find all kinds of people to talk to.
That's a really good tip that you just gave. I think a lot of people, like those are really good tips. Finding a hashtag and how much just a hashtag can create such a big difference. And you're right.
Like change your life.
Hashtag psoriasis, you get all this content. And I think that is so valuable for so many people. So thanks for sharing that. What would you say to those who are having trouble advocating for themselves at the doctor's office or in different settings?
Don't give up. Don't be afraid and keep fighting. And if that means taking somebody with you that is willing to speak up for you, take that powerhouse with you because it's worth it. And you need to find the best care treatment plan for you. And it's out there and you will find it eventually.
Thank you so much, Jenny, for coming on to the podcast today. I had such a great time talking to you about your experiences with your rheumatologist. I know it wasn't the best experiences, but that was something. How you found out about all your allergic reactions and how you kind of dealt with that. I think that's so empowering to other people listening in and who might be dealing with allergic reactions to medications, constantly being given medications and it's like not working. It was so interesting to hear about your other diagnoses. I know it might not be that fun, but inform other people about other health conditions that are out there. So everyone, make sure to check out Jenny's social media channels. I'll have them linked down below. Give them a follow, like, comment, subscribe. And yeah, I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much, Jenny. Bye.
Thank you.
I can't hide, 'cause growing pains keeping me